Good afternoon and welcome to the Health and Adult Social Care Scrutiny Committee today. My name is Jo Lawson and I'm chair of the committee. If the panel could introduce themselves, please.
Eric Firth, Dewsbury East.
Kim Taylor, Voluntary Co-op-T.
Helen Clay, Voluntary Co-op-T.
Alison Munro, Almondbury Ward.
Bill Armour, Kirkburton Ward.
Are there any apologies?
Got apologies today from Councillor Donovan and Councillor Zaman.
We can move on to the minutes of the previous one of the previous meetings. Can I move that these are a true and correct record?
Second.
Okay, thank you. Are there any declarations of interest? I'm so sorry, Councillor Firth, that you've been a bit poorly, and do hope you can manage to attend the whole of the meeting. This meeting will be held in public. Are there any deputations or petitions?
None received, Chair.
Any public questions?
None received, Chair.
Okay, so we will then move on to item number 7. If the panel could just introduce themselves as well, and then I believe you've got a 10-minute presentation for us.
Hi everyone, I'm Melanie Brown. I'm the Wakefield Place Officer for Wakefield District, so thank you for inviting me today.
Afternoon, Vicky Dutchburn, Interim Accountable Officer for Kirklees Place.
Hi everyone, my name's Ian Holmes. I'm Director of Strategy and Partnerships and Deputy Chief Executive for the West Yorkshire ICB.
Hi, and I'm Mark Brooks. I'm Chief Executive of South West Yorkshire Partnership Teaching NHS Foundation Trust.
Thank you.
Okay, there isn't a presentation, Chair, off the bat that we were specifically asked not to do another presentation. So I'm just going to do an introduction and then we can open it up for wider discussion and conversation.
Sorry, that's what I actually meant, that it would be an introduction.
Right.
I didn't want to launch straight into our question.
No, that's fine. So what we have done in preparation for today is obviously we've circulated the paper, which is headed Briefing Report on the Kirklees Partnership Agreements. And what we also tried to do was just address some of the questions that had been posed at a high level as well. I appreciate there appeared to be a lot of appendices with the documents that were sent, but that was information that we'd either shared previously, just so that you had it in one place, or information that we'd shared with Health and Wellbeing Board, and equally then some to address the specific questions that you'd asked for. So today we've come specifically to talk about the proposed changes regarding the governance arrangements for the ICB, the current ICB, and the development of the place provider partnership arrangements to take us forward. This is in line with the national direction and mandate that we've had for the national changes to the integrated care boards, but also in line with the 10-year health plan that we're working to. I think it's important for us to clarify and note that in the changes that we're making, this has been done in partnership, and we've been working with the existing ICB Health and Care Partnership Committee that meets. So we've used those sessions with the current board to work through the proposed changes into a new partnership arrangement. And the partners that are in the current committee and that we've been working with to develop this are the partners that we are proposing. We will be continuing to work with some further enhancements. And the enhancements as we go through this reflect some of the changes that are being made both at West Yorkshire Governance to enhance it within the place so that we recognise it at place. I think it's important for us to remember that through these changes, Kirklees as a place is still seen as important and will have a big emphasis on how we deliver the services locally, both into our integrated health teams and community-based services, but also then in the feedback and the information that we share with West Yorkshire, it will keep that place focus. It's also important for us to note that all the work that we're doing is building on what we currently have in place in Kirklees. So I think we've got a lot of years of good partnership working, strong collaborative working with a whole range of partners. That's our statutory partners, but also our voluntary sector community, third sector, either through the third sector leaders or Kirker. So it's building on those relationships as well, but then strengthening some of the relationships that we have with primary care. And our community services into this working. So I think that is a fundamental principle that we've taken, and what we've been very clear about is that it's not starting from scratch, it's about building and evolving those processes that we've already got. One of the points that I did want to address, and I know we'll pick it up and have some specific questions, is about the Calderdale, Kirklees, Wakefield dynamic within this. So we do know that the changes around the staffing available to support us is going to be reduced through the changes that we have. So it's about how we can make sure that we maximise the expertise resource that we've got, and also where it makes sense to look at doing things consistently across that footprint because of the dynamics we've got with 2 acute trusts and the mental health trust, that we work as closely together as we can to do that. So we will be doing some work on a Calderdale, Kirklees, Wakefield footprint. Again, that's no different to what we do now, so we do consider all the changes and any service and pathways that we're doing on that footprint to make sure that we've got consistency of service delivery, so we avoid postcode lottery, etc. in doing that. But there will be a place-facing element into this, and Kirklees will have a strong focus, and that will get fed back through the work. So there will be some priorities that are specific to Kirklees, as well as on a Calderdale, Kirklees, Wakefield footprint. And I think from an OSC perspective, when we get into talking about in the future any potential service changes or service reconfiguration, that's where we will make sure that, depending on the footprints of those, we'll engage completely with the OSCs about the process to ensure that it meets the requirements and that you're fully involved in those processes, you're happy with the plans, the processes that we're going to take forward on that. So some of those will be on a Calderdale, Kirklees footprint because they might have a dynamic with CHFT. Others might be more aligned with Wakefield because of the Mid-Yorks, and then there'll be some that we do collectively. And we've got examples of where we've made that work really well in the past. For example, the older people's mental health work that we did last year, we did that as a joined up. We got together and we agreed how the OSCs would come together to help us do that consistently once, because it covered that footprint. So I think there's some key points that I wanted people to be fully aware of. The place provider partnership that we'll go on and we'll talk about at length today will be a Kirklees place provider partnership, and then there will be integration with Calderdale and Wakefield to make sure that we do things consistently, but we will have that as place facing, so the integration and the close working with the Health and Wellbeing Board will be maintained as it is now. So I think currently we come to Health and Wellbeing Board every meeting. I can see Councillor Addy on, and we do updates regularly. So that relationship will be maintained through the process of change. At this point, I don't think I really want to go into anything else that's in the papers. I want to leave it open to you, but I'd just look to the panel and see if there's anything additional they want to add at this point. No.
Thank you, Vicky, for that introduction. We obviously sent quite a few questions through, and what I feel is some were answered, some were slightly, is this what is actually meant? So we'll actually just go through the questions. So the first one was in relation to the sponsorship and governance groups. Will you expand the sponsor groups and governance subgroup memberships to include a representative from Kirklees at officer level, e.g. legal, financial, governance and public health? And can you also confirm with us who currently sits on those groups? I think one of our main concerns was that it didn't seem from all the papers that there was much involvement with with actual Kirklees at officers levels. We appreciate that you go to the Health and Wellbeing Board, but obviously from a scrutiny point of view is the last meeting was the first that we'd heard about most of these changes.
So, sorry, switch myself on. I'll take that question first. So within your pack, I think I attached an appendices that had the sponsors group and the membership of the sponsors group and the governance work that's been attached. So that was included in your papers. I think it's fair to say that the sponsors group is an informal group that we chose to establish of the chief execs of the key partner organisations, which includes representation from local authority, the two acute trust, the mental health trust, and Locala as our main community provider. And the remit of that group is to try and help us help work out what it is we need to be doing and the work that we need to be doing across the partnership. From that group, then it falls into a design group to help us design it. But that's how we've framed the work that we've done through the development sessions of the current ICB committee to make sure that the work has been going backwards and forwards on this development. The governance work we've undertaken, I suppose at two levels. There's been a level that has been specifically Kirklees, so we started from the premise we already had sets of terms of reference and agreements in place for the Health and Care Partnership Board, but then we've worked very closely with Calderdale and Wakefield on this to make sure that we've got a level of consistency of the approach that we're taking, and also to support us with things like legal advice that we've been undertaking. So within those groups we set up a series of work streams supported by the West Yorkshire ICB governance team, the formal governance team, because alongside the work that we've done at Place, it's had to align back to the changes that have been made to the board structure at West Yorkshire and any constitutional changes there. So we've made sure that that's been linked back at all times for us to be doing this. And some of the decisions on the working groups were who would represent for various elements as we were doing it. So we've had representatives from all places, but as an example, something that you just raised there, Chair, about some of the legal advice, it was agreed between the three councils that Wakefield would operate as getting the legal advice on behalf of the partners, and they've done the feedback between themselves on that.
Can I just interrupt there? Who actually decided, at what level was it decided that Wakefield would take, Wakefield Council would obviously be the legal local authority person?
No, it wasn't Wakefield Council, just to be clear. Yeah, we've been working together across Calderdale, Kirklees and Wakefield to get independent advice for the Integrated Care Board. So it's not about the local authority legal teams. Just want to be clear. We've been getting some advice around how we run our committee in the future, what that form would be. So it's independent advice for the ICB. It's not about your free legal teams. So I just wanted to be clear about that.
The bit that the Wakefield took the lead on was on behalf of the three local authorities. They agreed between themselves that Wakefield Local Authority could be the representative on the working group to feed it back. So that's where that was. It's been Hill Dickinson that's given us a lot of our legal advice.
Thank you. Have the panel got any specific questions on this? Councillor Munro.
Yeah, just if I could just pick you up, Vicky, on what you just said in relation to about the people who were involved in the meetings regarding sponsorship of groups, etc., and legal. You know, it could be said that, you know, you've got far too many huge organisations involved in this, and information is not getting through. Which is a concern for me, that you're not speaking to the right people, and you're not all on the same hymn sheet. That's just an observation from what you've just said. I've also noted it's still good to hear that you note Kirklees is an important partner. I don't know what circumstances you would disregard them as a partner. We didn't say that. But my question actually is about Paper 1, Appendix 3, Kirklees, KPP, baseline self-assessment. Transformation and delivery emerging, stewardship and resource emerging, comms and involvement developing, capacity and capability emerging, partnership, leadership, development, purpose and governance, emerging. So my question is, how long is it going to take for each element of this to be fully operational? Are you working to a deadline? When do the ICB pass everything over officially? What's the deadline date that the ICB have set for everything to be fully functional and they pass on their responsibilities? Because I have great concerns about this. Thank you.
So regarding the self-assessment framework, the self-assessment framework is there for us to assess ourselves as as partnerships moving forward. The self-assessment that we've undertaken is only recent because the actual framework itself has only been out with us probably 6 weeks, 2 months maximum. The timeline that we're working to, there isn't a definitive timeline. So what we're currently working to, and I think what we've said in the papers, is that the intention is that we'll go into shadow form from April. So the responsibility will still sit with the ICB at that point. It's the governance around our partnership. So what we've done is we've been able to move some of the subcommittees that the ICB had to allow the partnership, the PPP, to take over. So it's the same members round the table having similar discussions to what we've always had, to be perfectly honest, and that's how that will work. The intention that we're working to at the minute is that we're working to a timeline of 12 months. So we're looking to try and get to a point by April 27 that West Yorkshire ICB will be able to contract with the place provider partnerships at that point. As we move forward, what we've done with the self-assessment framework, and we're all using the same self-assessment framework to gauge where each of the PPPs across West Yorkshire are, is we've got some markers within that says what needs to be in place to give us assurances that the shadow form is robust. Sorry, is robust and will be working. Sorry. And I'm going to say something. So we're not looking that we're going to be up in that maturing one because the development will be continuing. There are some markers within it that we've said will be, I'm going to say absolute, so the things that we're saying we've got to be able to achieve to get the assurances from West Yorkshire that the place provider partnership is in a strong position, a confident position to take on a place provider partnership and take on a contract. But alongside that, it is worth noting that whoever will be hosting the place provider partnership and our partners will need to go through a due diligence with their own boards to say that they're confident that we're safe and we're sound and robust enough to move forward as well. So the indicative timeline is April 27.
Thank you. Is there anybody else from the panel, any specific questions or on the first issue? If we can move on, thank you for answering our question around the actual design group as to how long it's actually been meeting and who actually attended those meetings. Is one thing that we did wonder about was we've obviously got from our executive team, we've got a member from adult social services, but we also thought that there should have maybe been somebody from children's there.
Yeah, so again, we've had these discussions as a partnership and a collaboration. The membership for the design group, the representatives were drawn from our existing ICB Health and Care Partnership Committee, and the representatives on there, they come with a broader hat than just adult services. So there are times when it's adult social care rep might be there, but equally it's the children's and they deputise for each other, bring it back into the council and share it. Equally, it might be Steve Mawson that attends, and we do that with all our partners as opposed to having 60 people.
Thank you. If I can invite Councillor Smage, who's actually online.
Oh, thank you, Chair. I just wanted to clarify the design groups and the sponsor group. So the sponsor group composition, can you just clarify this, please? That it is the 3 acute trusts who are each leading one of the place provider partnerships for Calderdale, Kirklees and Wakefield. And then it is ICB officers on the sponsor group. And on the governance subgroup, there is one representative from a local authority representing the other local authorities. Can you just confirm that we have that right, please? And can you confirm as well the design group, is that going to expand, or are you going to expand the composition on the sponsor group so that there is local authority representation on the actual sponsor group? Because all decisions seem to go back to that sponsor group. Thank you.
So the sponsor group isn't a decision-making group. The sponsor group is sponsoring the work and the development of the PPP development. And that's why it's the makeup it is. It's got ICB officers, and it's got the three leads of the proposed PPPs who've been identified as the leads on that. So that's to help us work out what is the work that we need to do and how that work might then be tasked to somebody else to be able to do it. So that's the sponsor group. At this time, I don't think we've got an intention to expand that. In fact, one of the things we were looking at is it's a time-limited group, is the sponsors group. So actually, does it need to carry on, and what form will it be? So it is an evolving, fluid group depending on the asks and what we need to develop. The design group, each of the places has their own design group because of the development of the local PPP. So what the sponsor group does is we do the cross-checking. Have we got things, is one place doing it different to another? Do we need to get a degree of consistency? Are there a series of questions that we can ask once instead of us all doing it? So that's the remit of the scope, really, of the sponsor group to help us out with that. The design group, like I say, is at each place. So what each of the partners has done is nominate their representatives onto the design group. The design group get tasked with actions that come out. So, for example, the design group took a lead in getting partner feedback onto the consultation that's currently running on the ICB. They've looked at the current proposed structure of the integrator function and helped to look at where we think there might be some gaps or we could do things differently, and then they feed that back into the sponsors group so we can decide and agree the piece of work that needs to be prioritised and taken forward at that point. So that's what the design group are currently doing, or we give them specific tasks that they then do. The design group does adjust their membership, so they have a core membership, but they will bring other people in depending on the task that they've been set. So currently one of the things that they're looking at is the future of quality, where the quality reports and things will go. So with all the providers, all partners have nominated their quality leads to work with the design group to start working that up to bring back for us to look at what that might look like in the future.
Thank you. Councillor Smays, do you have any further questions you wanted to ask on that particular question?
I don't want to hold anybody up really, but I just can't get it in my head really, because obviously there's a lot of questions for the panel has, but there is a decision flowchart that was provided, and the CKW sponsor group undertook options appraisal, agreed decision-making approach, and has a governance subgroup, and the sponsor group signs off the MOU and governance handbook. So, you know, it's, to me, it is making decisions in that sponsor group, as is the governance group. And I think this is part of the issue in the governance of the MOU and the not understanding the council processes and the council not having a good voice in there, in that the council's Kirklees Council, as opposed to Kirklees ICB, needs to be able to have a voice in there. Thank you.
Do you want me to come back?
Thank you, Councillor Spage. If you like.
I was just going to say that I suppose the decision that they've taken is that the work that has been done today is robust enough to start sharing, and that as a sponsor group we are comfortable with where it's got to. They're not taking the decision to sign it off fully because that has to be through our partnership and back through West Yorkshire. So it's about that assurance on the work that we're undertaking is addressing the asks that have been given.
Thank you. Going back to one of our concerns was about the actual decision pathways within the shadow years. You've got these shadow place partnership boards, which it's fantastic that they aren't just going to be told the 1st of April it's your baby now. But how is that actually going to work effectively? Who is actually going to be making the decisions during this actual shadow years, and what relevance will the shadow partnership boards have?
So it's going to be on different levels again. So the proposal for the Place Partnership Board is going to be to look specifically at that work that is done in our local communities, across our community primary care, integrated neighbourhood health work. What is the transformation that needs to take place, and help develop those pathways. The ultimate decision making and accountability will be retained by the ICB. So they'll be looking at the work, supporting the work in our place, and then making the recommendations back up, but the ultimate decision making about if it's a change, if there's any money flows, etc., will be held by West Yorkshire ICB. And in the shadow year, currently as it stands, the place director will be accountable to the West Yorkshire Director of Strategic Partnerships. So it's still the West, and it's, I think the other thing to clarify is we're talking about the health, the NHS money into these partnerships at this time.
Thank you. One further question I've got is, obviously the ICB is being significantly cut back. Are there going to be enough staff to actually make all of those decisions at a West Yorkshire ICB level to also then support in this shadow year the place partnerships?
Yeah, I mean, you're quite right, Councillor. There's a significant reduction in the running cost envelope that ICBs have to work within, and for West Yorkshire that means moving from just over 1,000 staff to around about 650. And what that obviously means is we can't do the same volume of work that we were doing before. We have received a document last May which is guiding the work that we're doing around this, which is the Model ICB Blueprint. And what that tells us is that there are a range of things that we'll need to continue to do, and a range of things that we were doing previously that we won't need to continue to do. So, for example, digital and workforce leadership are not functions of the ICB going forward. So it's not a case that we've got to take 300 odd staff out and do the same amount of work. It's a different set of functions. One of the consequences of delivering those reductions is that we've had to centralise some functions at West Yorkshire level to deliver them with scale. What we were really keen to do through that process was protect some of the transformation capacity that Vicky's been describing at place level. So around about 120 of the total number of staff will be working in places supporting the development of place provider partnerships and the integration of service at place. But you're absolutely right, the work that we're doing is looking at how we can continue to deliver the core functions of the ICB of the future with the reduced running cost allowance that we have to work within.
Thank you, Helen.
Thank you. Just going back to slightly to an earlier question around how and when decisions are going to be made. I think we've got a better idea of by whom and who the members will be, etc. But I was just wondering if the overall change management plan, the programme plan that I'm assuming you must have to document everything that needs to be done, what decisions need to be made by when, etc. Is that available to all the partners and includes a sort of like risks and issue log and mitigation plan?
So I think it depends on which plan we're talking about. So there's obviously plans held at an ICB level regarding the organisational change, the risks, the governance and everything around that. What we then have at places, and in Kirklees you'll have heard as well, we'll have been and talked to you about our well programmes and the Starting Well, Living Well programmes that are leading the pathway developments in those areas. They will be retained and we will carry on doing that. So a piece of work that's been undertaken currently is with those leads. So we've got Locala lead on the Starting Well, etc.
Sorry to interrupt, just to clarify, you mentioned earlier about some work that the design group was doing that felt like it was a particular piece of work that they were working on now. And my assumption is, obviously, work needs to go on now and decisions will need to be made. You can't make all of them all at the same time. So it must be broken down into, the design group will look at 4 work streams.
We do have a work plan for that and we can share that.
Right, is that shared across the partners?
It's shared with all the partners that are part of the design group. It's an open document. We share it back on a CKW footprint as well. There's a higher level one so we can see where each of the places are. So if you want to see that, yes, that is available.
That I think that would be helpful because that would help us then to sort of see where the key decision points are.
And that's about the development.
Been worked on and what the key decision points are.
Yeah. So just for clarity, that is about the development of the place provider partnership. It doesn't talk about any services or any pathways. The design group are only focused on the place provider partnership.
Okay, so apart from the design group, are there other groups working on other areas of this change? So whatever's changing, there must be groups working on it, and they must have kind of like deadlines, and then what they, that decision's made on that, then they move off into something else.
So we have a plan for that, for the organisational change, yes, and we can share that with you.
Is there any other questions from the panel? One thing that we did actually raise was about the quality of the place partnership. Is obviously we're in the unique position in Kirklees that we will have 3 acute NHS providers on there. Is you did actually say that you were seeking further clarity with the actual governance group there, but is there any time frame of when the quality would be looked at again and when that will be cascaded down obviously to Kirklees partners?
So the Kirklees partnership quoracy has adopted the same quoracy as we had for, well, I say the same, virtually the same as the current Kirklees ICB Health and Care Partnership Committee. So it does include all our partners are community provider, voluntary sector, and Health Watch are all members of that, and they will be on in the interim period through the shadow period. If it changes at some point in that, obviously we will share that back. The difference is that instead of it being led by the ICB, it will be led by the partners, and the ICB will be a representative on there going forward.
Thank you. Can I bring Councillor Smith?
Just to say, I mean, this issue came up in the West Yorkshire Scrutiny meeting last week, and I think it's a good spot and something that we are looking at. So we will look at that as part of the MOU development.
Thank you. I will bring in Councillor Smith.
Thank you. Yes, it is. I think Kirklees is unique in that we have several acute trusts across our footprint. And therefore, using one area as the model doesn't actually help Kirklees. And I do think there needs to be discussions with Kirklees Council on this. You were saying about the difference between the Kirklees Place ICB and the Health and Care Partnership. Well, the Health and Care Partnership is a lot wider membership than is listed in your MOU. And at the moment, you've got the quorum shall be 3 members and at least one provider, chief exec, and 50% of the membership. Well, there are 7 organisations listed on the MOU membership for the place provider partnership. So that's 3.5. And that also applies if there's urgent items and the meeting cannot be held. I think this really does need to be looked at, that there is a mix of voices in that quorum, especially if we're going to go forward out of shadow into actual, and that decisions on service reconfigurations, etc., could go through the place provider partnership. It needs to be right and for everybody to be comfortable with this from the beginning. Okay, thank you.
Do you want to come first?
Yeah, thank you for that, Councillor Smage. And this is really good feedback, and we're at that point now where we're going out to partners and we're getting a range of feedback, and we will take that forward and put that into revised terms of reference and our MOU moving forward for all of the places across West Yorkshire. So thank you.
Did you have any further follow-up question, Councillor Smage?
It is, Kirklees is a unique place, and I think that the membership of the place provider partnership, it leads from the quorum to the membership actually, is that for Wakefield provider partnership, they have public health in with a vote. That doesn't happen in Kirklees. The Kirkwood Hospice can attend but doesn't have a vote, and there's no, children's services also need to be at the table, don't they? So I do think that before the ICB take a decision in March on these MOUs, these things need to be sorted out, because what would happen if a decision is taken and then later in a couple of months somebody says, well, actually we need to change this, or we need to make decisions before we can change it. And I really think that this should be dealt with as a matter of priority. Thank you.
Thank you, Councillor Smage.
So in response to that, I think there's just a couple of points. So the membership and the voting, like I say, has been based on the existing health and care partnership membership that we've got in place. So what we didn't want to do was throw the baby out with the bathwater. Public health, we have already noted, and certainly we've moved it around so they are a formal member of the new partnership. What we have recognised, and we're still working through this, so there's a lot of development ongoing, and it's about where we start on April the 1st this year will be very different probably to where we land by the end of the financial year. Is that things like the hospice, so how big do you make it, and how many people do you have that can have a vote, and how can that influence, or I suppose in some ways stall the work that you're doing. So underneath the partnership, we've got a whole group of delivery groups. I've already mentioned the WELL, so we've got Starting Well, Living Well, Ageing Well. We've got the Mental Health Alliance, and I can't remember now what the 5th one is. But within that, their memberships are made up of the partners that are very, it's the Dying Well Board, that lead and deliver those services. So Kirkwood Hospice on the Dying Well Board are one of the very key partners. So everything would go through that if it was related to end of life, developing the end of life model, before it came back into the PPP as part of that governance process.
Can I just then interrupt you? So you would have, say, your sub-board, but anything moving forward would then have to go to the Place Partnership Board for actual ratification for services to be commissioned. So in theory, could be blocked.
So I'm going to say I would find it highly unlikely things would be blocked, because a direction of travel would have been given to the Dying Well Board or the Starting Well Board about the priorities and areas that people were working on. They're the people who've got the expert knowledge to look at the pathways and make the suggestions, looking at the redesign of pathways within that. And then it would come back through the place provider partnership that it was delivering what the partnership had requested against the high level scope that they'd been given. The money would need to be ratified then, so if there was a business case for more money, it would have to go through a formal process for more money, or if it was a significant service change, obviously we'd have to take it through due process at that point. But we would use, those mechanisms are in place now, so they do a lot of the assurance, the governance, feed the recommendations into the current health and care partnership for those decisions. So it's where we draw that expertise, the clinical experts, the providers into those discussions.
Thank you for that clarification. Kim, did you want?
Just talking more in general about the membership, where does pharmacy come into all of this? Because, you know, when you're looking at services moving into the community, pharmacy plays quite a big part. So from what you've just said, I'm presuming that on the Dying Well board, there'd be pharmacy representation because of palliative care, etc., etc. But where does it, in a broader sense, where does pharmacy come in?
So that's part of the work that needs to evolve and develop about where community pharmacists will feed in. So currently it feeds into each of our well boards at the appropriate time. They don't have a membership on any of our committees at the minute. And I think that will evolve as time goes on and the community integrated neighbourhood health teams start to grow further and further develop. We don't directly commission with the community pharmacists at the minute.
No, I know, but it feels like they should have a voice because they're quite a significant.
And they do
part
play in
of
at a
the
West
community.
Yorkshire level and at, what they've done through the acute trusts and things is we do have those discussions with them about any changes or any recommendations or any developments. Okay. And certainly with the hospice, it is part of a key because there's a direct contract between the hospice and one of the community pharmacists. So they are in at that level. Oh, sorry.
Thank you. Is there any other questions on this specific answer that the panel actually wanted to put? If we can then move on to the Memorandum of Understanding, is who exactly within Kirklees is expected to actually sign this? Because there seems to be different timescales, different people actually be actually expected to actually sign it off. So can you just tell us who you are expecting to sign the Memorandum of Understanding off?
So that's on pause at the minute, I would say, for two reasons. One, it's still going through a legal process. So by the end of this week, we're expecting Hill Dickinson to have come back with some further iterations to the Memorandum of Understanding. So in principle, what we're saying is, and it's going to sound a bit vague, this, as long as the partners are sat round the table and talking to each other, working with the terms of reference, given that the accountability is still sat with West Yorkshire, the timeline isn't as crucial as we'd been led to believe from a governance perspective. That will come back in and get all partners to have taken their advice and have their discussions. The key partners that we will need to sign that off are going to be the people who host it and already get the NHS money. Like I say, currently on the terms of reference and things that we have for the health and care partnership and the way that we work there, we do it off the back of the terms of reference and we always have done. So for me, and I've spoken to Mel and people about this is about us being collaborative, working together, and as long as we're all sat around the table talking, we don't believe there will be problems that we can't overcome. We will disagree at times and we'll have to work through that, but we've got 12 months to keep evolving that until we get into a contractual arrangement.
So to clarify what you're actually sort of saying, moving forward from in the shadow period, there is no need for a Memorandum of Understanding, and therefore this can be evolved, is scrutinised by the various different partnerships over a 12-month period. And when would you then expect the partners to actually sign this when it becomes a more formal?
Yeah, I think that's exactly right. So in the shadow year, as Vicky's described, we're not actually doing much different in terms of formal governance arrangements. What place provider partnerships are doing is they're formalising their way of working ahead of something which will feel much more significant as when that partnership, will take a contract in from April 2027 at the soonest. At that point, it becomes a much more formal governance arrangement and a much more formal entity, and the ICB would look to have a contract with that entity. Obviously, we'd be really keen that local authorities will sign up to that. I don't think we would prescribe how local authorities sign up to that. We'd want to work with you as we would with other NHS organisations to say what's the right governance route for you to do that. But there's certainly no urgency to get any of this signed and sealed by the 1st of April 2026.
Thank you for that, because obviously is what we were led to believe at the meeting the beginning of February, that obviously this was going to happen, this actually had to happen within the shadow year. Sorry, did you want to come back?
Yeah, thank you very much, Councillor Lawson. I just wanted to highlight as well that currently Kirklees Health and Care Partnership and Wakefield Health and Care Partnership and Calderdale Cares Partnership already do have MOUs in place. Our partnerships at the moment already do have MOUs and partnership agreements that we've had refreshed last year, so we could carry on using them in the interim period. But what we were trying to do here was refresh these for the shadow year, update it with some of the updated membership. But I understand, the comments and the reflections from a number of partners have been, can we just slow this down, put some of the feedback in, reflect some of those changes in the updated MOU. So we'll absolutely do that. And as Ian has highlighted, the critical time point will be before we get into April 27, when we've got the formal contracting arrangements in place. I hope that's helpful.
It is, thank you. Councillor Firth.
Thank you, and thank you for trying to explain the MOU to me. But can I ask you, under current understanding, if, because our executive officers, and like yours, they're all very busy people, and can't possibly attend every single meeting, is there kind of arrangement that can send a substitute? Or if not, why not? It is.
Yeah. So within the agreements and the terms of reference, we've said who the organisations are and key, but they can all nominate a deputy. So as long as we know ahead of the meeting that it's the deputy attending, we've got chorister. So we do that to check chorister. And that's exactly how we work now.
Thank you.
Thank you.
Just to clarify then, so April 26 feels like it's an indicative date. It's a bit of a movable feast. Is that the case for April 27, where it's more formalised? Because I suppose my concern is that everything is slipping. There's still a lot of queries. There's still awful lot to work to do. It may not be April. It may not be May, June, July. There will be a knock-on effect, won't there? So what will happen with the April 27 date?
I mean, could I come in, Vicky? I mean, I just wanted to be really open. We have got dates in place to have our first place provider partnerships both at Kirklees, at Calderdale and at Wakefield, and those dates are in for April. So we have got those commitments to that date, and we know we're working towards an April 27 date in terms of the formal contracting arrangements, but we will have to assess that and understand if we're ready to progress that. But our intention at the moment is to do what we can to be able to deliver our contracting arrangements for April 27, but that could extend if we're not ready.
So it could extend.
It could, but that's not our intention.
No.
Yeah.
Okay, thanks.
So can I just clarify that? So did you just say that the intention is that the PPP is in shadow form complete, in shadow form by April this year? And if so, is that the agreement with all partners, that they will be available and able to meet that?
So, yeah, the PPP in shadow form will start meeting from April. What we've done, just to clarify with everybody, is the health and care partnership that exists now, we have morphed into the PPP. So the cycle of meetings has just followed on. It's just going to become the PPP. So the partners that were already round the table, whether it's Steve Mawson or whether it's Michelle as his deputy who attends, they've got those dates in their diaries and they will be attending on behalf of, as part of that partnership.
I mean, that's news to me, and I don't sort of recall it being in a mess. It's good to know. I mean, I guess it's also along the lines of as I understand it, the memorandum of understanding had a deadline, a very, very short deadline to be signed off, which, as you said, partners fed back that wasn't possible. With that learning in mind, is that something that you would take forward when perhaps producing something like this, that to get the partners' thoughts and feedback on that, or work with the partners to avoid that sort of thing happening in the future?
Yeah, and we have done, we've agreed that, and I think, and to be fair to ourselves and to you, it's about the pace that we've had to move at, because we've had to move quite quickly, and people be aware there was a pause put in at the summertime and then suddenly it picked up pace again. Our governance team, so it's the West Yorkshire governance team, have been helping us develop the MOU and the documents. So some of it came direct from their office, and they were aligning it to timescales they had to do for the West Yorkshire governance as well. So it's things like that. So yes, we've taken that learning on board, and we'll make sure that that's communicated.
I appreciate that. Thank you for just explaining that. I think also I think all the partners need assurance that when we're talking about partnership, it is real partnership, and that we don't get then kind of, oh no, this has come down from on high. Because that's the whole point, is that it's the place, that's where the decision will be made. Thank you.
Yeah, I mean, we absolutely endeavour to work as good partners, right across the health and care partnership. We also understand and respect the role of scrutiny in relation to these changes as well, and that's really important too. I guess what I'd say just about the April 2027, that is the timescale, that is the ambition. This is a big change. So we've got 1,400 contracts across West Yorkshire currently. We're looking to wrap those up into a much smaller number of contracts, which are more focused on improving outcomes and integration. And doing that is a lot of work. And doing that at a time when there's so much change in the system anyway, and we're waiting for legislation to come through, is challenging and complex. So I think that's why Mel gave a bit of caution around the April 2027 date. We're doing this because we think it's the right thing to do, but there is a huge amount of change happening in the system which will impact on this work.
Can I bring in Councillor Smage online?
Thank you. Thank you for clarifying that you're not asking everybody to sign up to the MOU. I take it you've had some different legal advice, therefore. That would be interesting to understand that. You're talking about the health and care partnership, and I'd just like clarity, please, because it states on the health and care partnership website that partners include the council, Locala, the 3 trusts, but also a variety of primary care networks, the fire service, local care direct, health watch, the police, the Kirkwood, community pharmacy, third sector leaders, and the ambulance service. So when you say you've morphed the health and care partnership board into the place provider partnership, can you just clarify how you've morphed that, and if those partners are still involved in the health and care partnership board? Thank you.
So those partners are, and they get the communication off the back of either the design group or the working groups that we've got with Share It. Some partners choose to be more engaged in the process. So I think it's fair to say that YAS tend to come by invite to the meetings. They don't attend every meeting that we've got, but all those partners have an equal voice and an equal access to put things on agendas to be discussed. I don't know if that fully answers your question, but they are the same partners.
No, so this is what I don't understand, and it's probably me that's having a problem. But in your terms of reference, etc., you named 7 organisations who will be involved in the place provider partnership, and yet you're quoting the health and care partnership as the people who as the organisation that the place provider partnership's been morphed into. I understand the design group, okay, but the actual people who are doing the recommendations under this shadow year, that's not the same membership as the Kirklees Health and Care Partnership. So how are you going to involve all the people on the Health and Care Partnership in recommendations in the shadow year? Thank you.
I'm still on. So a lot of those partners choose to engage through the well programmes as opposed to coming to the formal committee because, so I'll use the fire partners as an example. So they engage really proactively in our Ageing Well programme and around our Falls programme. So some of that will continue and do that, and they will feed in through that mechanism. Equally, some of that work will be done on a slightly bigger footprint at times as well, because if we use the Falls work that's taking place across Calderdale, Kirklees and Wakefield, they're represented at that, and then they're feeding their views in that way back to us. So they don't always sit on, well, I can't remember the last time Fire sat on one of the actual formal partnership meetings, but we make sure that they're engaged on their pieces of work through the well programmes, which are the delivery programmes.
Does that answer your question, Councillor Smage?
No, not really, but you obviously need to move on. But I can understand the fire. I can understand their position, absolutely. But there's other partners in that list that don't seem to have a strong voice.
Yes, again, yeah. I mean, I'm not going to go through the entire list. I use fire as an example. I'll use Yaz as another example. So Yaz are fully engaged through the urgent care boards. So we have urgent care boards on both acute footprints, and they're fully engaged through that process. So when we're looking at our urgent care pathways, any of the contracts there, they feed in at that mechanism and then give the assurance into the board, and that's part of the assurance process that we go through at that point.
Thank you. Helen?
Just basically to say, no, Liz, you're not on your own. I don't understand how you can have such a wide group of who have a remit and a purpose and outcomes to then sort of say, oh, well, you're not really included. You don't come very often. You do that over there. Can you see the confusion? It's kind of the, you're saying it is that body, but then we're saying that, well, some of them don't really represent. So how do they know when they need to do the day-to-day work and make decisions at that level, and then do the PPP work at that level? That's why it's confused. If I was a member, I would be confused as to what the expectation of my role was on that.
So we've not changed, again, I'm going back to the remit, we've not changed the remit. So where we engage with YAS and people through Urgent Emergency Care Board, that is continuing. So they know that as part of that process to get that feedback in. Additionally, where they engage in some of the core West Yorkshire levels, so either through WIAT or the Community Collaborative, that's already in place. The end of life is very specific, and we have 2 levels for that. There's end of life at Place and end of life at West Yorkshire. So they have self-selected where they want to engage with us at this time. So that's how the membership has been derived. Yeah.
Last week we met in Wakefield as well with our overview scrutiny committee, so there was a couple of similar comments. So let us go away, look at the terms of reference and make sure that it's strengthened with the feedback that we've had, not just at Calderdale Losk but here today and at Wakefield as well. Because if you can't understand that from that perspective, we need to just look at it, make sure we refine it. So thank you for the feedback.
Thank you. Is there any further questions on that specific thing? One of the other questions that we actually raised was obviously with the engagement at Scrutiny, because I personally felt that a bombshell was dropped on us, and I think that could be replicated with when we had the joint West Yorkshire Health Scrutiny Committee. Again, that was what was coming through from other things. So moving forward, how will engagement with scrutiny committees happen? Is given the fact that the partnership boards are they're all sort of everybody is an accountable member, who will actually feed back? Whose responsibility would it be for this health scrutiny? Would it be with Kirklees itself, or would it be with the actual partnership board itself?
Yeah, so the first thing to say is I recognise what you're saying in terms of this feeling like it arrived left field, and the response to that. I think we've got a period of a minimum of 13 months before this becomes a formal contracting entity, and we're really keen to work with Scrutiny through that process so we can understand the thought processes, the approach that we're taking, the decision-making processes that we're putting in place in relation to that. I do feel like given that there will be 5 place provider partnerships on each local authority footprint, I do think there's an important role of individual oversight and scrutiny commitments to understand committees to understand the local arrangements. We will be in a place, hopefully in a month or two's time, where we've been through our organisational change process, and we'll have the leads for those areas for West Yorkshire, and that will be the main contact point, I would imagine, with Scrutiny at that point. We'll also continue to work with the West Yorkshire joint scrutiny arrangements. We made a commitment to that to Councillor Smidge last week, who chairs it, to kind of use the West Yorkshire arrangement to provide a bit of a broader overview of the general direction of travel and changes associated with this. So I think we can work out the detail of that over the next 12 months, but there will be conversations at each local scrutiny, and there will be point people for that, as well as having the West Yorkshire arrangement. Obviously this is a work in progress. But what we don't want to be is this time next year with another bombshell dropped on us. We need to work out the finer details over a 12-month period. I do feel that we need to have regular informal briefings or just briefing notes sent to the panel that we can actually then discuss informally amongst ourselves, and if there are issues that are actually raised, because what came to light at the last meeting was there appeared to be a lot of work being done that we were unaware of. So we can absolutely work on that basis over the forthcoming 12 months.
Have the panel got any further questions on this specific item? Again, the next thing that we asked was around children's, in relation to children's services, including sentence safeguarding. We understand that obviously certain issues will be dealt at a West Yorkshire level, but is locally, is especially around SEND, which is very much a topic that comes as a councillor. I have residents that will contact me that are having sort of problems just getting their initial assessments and various things. So when you actually said that there will be local resources and specifics, what will they actually look like in practice at the place partnership level?
So some of this is still being worked through, so you'll be aware because we've had the updates from this year's SEND inspection and report, and that was a partnership piece of work that was undertaken, so Health are very much involved in that. So the work that we're doing, unfortunately for Kirklees, our designated children's officer, etc., has resigned and things, but we're working through that as we work forward. So it's still one of our priorities. There will be, again, it'll be done on various levels, so there will be some work that is undertaken by the core West Yorkshire Integrated Care Board. So they're already in discussions about how the safeguarding boards, both adults, children's, domestic violence, are going to operate in the future, recognising the reduction in capacity that's available and where we can all get some efficiencies by working slightly different. So they're doing that. What we've also done through discussions, so I've been actively engaged in discussions with Tom Brailsford regarding SEND. And one of the things that we've done that's been shared across West Yorkshire is develop a service specification off the back of the SEND inspection about the resource that is needed to make sure that that is robust from our statutory responsibilities. So we're working through the recruitment into those posts now with Tom Brailsford. And then the third element that feeds into that is then the contracts that we have as an ICB with people like Locala and CHFT to do the assessments for individuals, and then the interdependency with the continuing healthcare team, that will be maintained. So we have got, for example, within the proposed structure for continuing healthcare, there is a sub-function within that which is children and young people, to ensure that we've got the capacity to support with doing the education and healthcare planning, making the decisions, etc., to be able to support that across Kirklees. And each of the places is addressing it slightly differently, just because they're in a slightly different place, but the outcomes we're all working to and the statutory requirements are the same.
Thank you. That was going to be one of my questions. Is obviously with something like this, we need constituency. That's it. That's the word. I still want to go constituency actually across the board. Yeah. It means for every child, young person within the whole of West Yorkshire, it should not come down to a postcode lottery. I'm actually pleased that work has been done, and it will look the same in all the actual place partnerships.
Can I just come in on that? I'm not going to say it will look identical. We're going for consistency in the outcomes that we want, the specifications to meet our statutory responsibilities. Depending upon the makeup within those places and how it's currently delivered, it might be delivered slightly differently, but to get the same outcomes for the children.
Just wanted to clarify. Obviously, what it does, it comes down, it is the outcomes, yeah. But the outcomes are the same. We can sometimes take a different route to get there, yes. But as long as all children, young people across West Yorkshire are afforded the actual same outcomes, that's good. Is there any question from the panel on this?
Yes, Chair. Given what's just been said, I realise it's the shrinkage is, you mentioned 350 people that was delivering this service prior to this new reconfiguration. At the end of the day, we serve the public like you do. Will there be any impact on the public, and will they notice any difference?
That question might be above my pay grade, I'm afraid. Well, so from an ICB perspective, like I say, we've got just over 1,000 staff who are doing really valuable work, and in future there'll be about 650 staff who will have a smaller set of responsibilities, because a lot of the thing that the ICB currently does will be done elsewhere. And done in different parts of the sort of the health and care system. Part of the challenge we've got is that there's other bits of this change that were announced after the ICB changes and are moving at a slightly slower pace. So if your question is about will the public notice a difference in services and outcomes and what they receive as a result of these changes, you know, I'm an optimist, and I would hope not, because these changes are designed to provide clarification and focus on what different statutory partners are doing. But you know, like I say, we're responsible for the health and care aspect, the NHS aspects within West Yorkshire, the ICB and how it operates, and there's clearly wider considerations there as well.
I think, Councillor Firth, so you would hope on the ground and the services that are delivered to our population, no, we would hope that people don't see a change. In fact, what we would hope is that things will keep developing, improving and moving forward, especially and specifically around the advent of integrated neighbourhood health teams and the work that we're doing there. So we're really, that's a priority, and we're driving it. Yeah, so we would want that to carry on. The bits that people might see a difference is, I don't know how many calls we get into the ICB office where we signpost and direct people, so we're seen as a bit of a point of contact. Some of that might change slightly because there won't be as many people and it'll be consolidated slightly differently. You would hope that we still get the response, but there's going to be a period of time where, depending how that is delivered, those people understanding what are the services in each of the places to do that forward direction, etc. But it's going to be about that, I'm going to say, that managerial type as opposed to on the ground services that people receive.
I just wanted to add as well that all of the places across West Yorkshire have been working through with the services that they're commissioned now to review them, to extend contracts, to look at what's appropriate, in terms of the future delivery. So I know Vicky and her team have done that for a number of your areas of service provision, haven't you, Vicky? So that will be why you won't see any major impact in terms of this. You all know, because you've been involved in this sort of world of us for a number of years now, that this isn't the first major NHS service reconfiguration, and there's some things that we work through together as we go into new arrangements, but actually the core of delivering services to our population in Kirklees will still be the priority of the new place provider partnership arrangement.
Helen, did you want to come in?
Yeah, I was just going to ask, how will you know?
So we've been pulling together things like, benefits realisations for the projects we do, trying to understand the impact that they'll have as well. So that's something we have to do as part of our business as usual, Helen. So that we've all been talking about how we make sure we strengthen that moving forward in terms of the place provider partnership too. So we will need to carry on with, well, what are the outcomes that we want to achieve, agree what those are at a place level, and the priorities, and then develop the impact of a monitoring process to help us understand as a place provider partnership how we have in the impact we want to. So that's really key part of the work that we need to do in Q1 of 26-27. We've already got things in place locally across all of the 5 places, but they may need refreshing, given the work that we're about to launch.
I think the other element.
Just come back. So I was going to say there's no specific plan to check on that. It's just business as usual, and if it comes up, that's where you. I'm not saying that's right or wrong. It's just, I think, just interesting because it will be a change, and whether you pick that up from the normal channels.
So I think there's a number of, again, layers. I keep talking about layers, don't I? So within all the pathway work that we're doing and the outcomes that we're measuring, we have got outcomes for like integrated neighbourhood health teams. So that'll sort of start to show us how people access services, where they access services, but also how they feel about accessing those services. So through our community assets and our community champions, we're working with them already on how they gather that feedback. Through our primary care networks, each of our practices has a patient user forum, so we gather their views as well that feeds into that. So all that will come in and help us shape moving forward as well. So we should pick up quite quickly.
I understand from the kind of like using what's already there, don't reinvent anything. But quite often with something like this, where it's kind of like a change that's higher up the food chain, it's not necessarily going to be noticed as such, but actually somebody stops working in the way that they used to work because of something else. That does then have an... So I know it was slightly jokey at the beginning, but it's kind of like this is the heart of... The whole idea of this is so that services are improved and they are where people are and not built around institutions, I believe is the basis for this. So it kind of feels like, oh, that's not it. This should be front and centre rather than after.
I think, so Mel, I think, or Vicky described the work we're doing on integrated neighbourhood healthcare, and the philosophy behind that is that we take a more proactive approach to identifying people who have need, people who have more of a chaotic relationship with services and potentially use emergency services more than would be ideal for them, and we work with them in a different way to support them to stay well in their own community. And the way you can measure that is by looking at a cohort of people with frailty or respiratory disease, what happens to them now, and then what happens to them as a result of the changes that we're making. We've got a lot of data of that nature. I mean, Mel's done some really good work in Wakefield that shows the before and after when you introduce integrated teams to support people in different ways. Those are the kind of things that we'll track in future. We'll also have the sort of the core NHS metrics around A&E access and GP access and those things, which we think should ultimately improve as a result of this way of working. So I wouldn't want to create the impression that kind of the outcomes that we're interested in are an afterthought, because I think they're built into the sort of the start of the process.
Yeah, and apologies if I've just sort of given that impression, because actually we regularly look at all of our performance indicators now in our health and care partnerships, and we will need to have that continue. But what we'll also need to do is just keep in mind population needs do change. You know, new job strategic needs assessments get updated, so we need to respond to those needs as they change as well. So we have got those processes in place, and they're really important as indicators of what we need to focus on in terms of transformation and service improvement. So sorry if that was clear earlier on.
And again, just for additional assurance, certainly within Kirklees, the cohorts of patients that have been identified by those integrated neighbourhood teams to be priorities have been picked by those integrated neighbourhood teams, looking at all the documentation, all the information we've got, the insights information, whether that has come through Health Watch, community champions, the data we get direct from the hospitals, our joint strategic needs assessment. So all of that has played into how the cohorts of patients that we're prioritising first as part of that development. And we're testing that methodology as we work on as well, to make sure not only does it have an impact at practice level or neighbourhood level, but then for Kirklees, and then contributing to the wider West Yorkshire, which feeds back to, I suppose, eliminating postcode lotteries, as you talked about as well. So again, it's layers upon layers that we're doing, but it started at the integrated neighbourhood health team with the partners, the patients, and the teams around those individuals.
Are there any further questions on this particular item there? We can actually move on. Is one thing that we had concerns is what involvement will our VCSE partners actually have? And looking through all the documentation that actually came through, that they were going to be identified. And can you actually tell us, for the Kirklees Place Partnership, who they will actually be?
So within Kirklees, again, I'm talking about layers, God help me, I'm going to have to go clean my brain of layers in a bit. We do a lot of our partnership working through third sector leaders. So we engage with those and we contribute to their infrastructure, as we do with Kirker. But then in partnership and collaboration with the local authority, with the council, we support through community champions. We've done it through Core 20+5 funding and things like that, where we've then evidenced that that's had real benefit. We've built upon that to be able to take forward. So within Kirklees, the voluntary community sector are a key partner in everything we do. Additionally, what we have within Kirklees, you'll recall, is we have, and it's completely gone out my head what we call it, but we have an agreement about how we will support and fund compact. Thank you, Mel. So we still work to the compact that we take through the Health and Wellbeing Board to make sure that they're fully engaged. So working with the local authorities team specifically, it's part of our BCF. We also have some key principles within that we agree about the levels of investment, making sure that we invest and growing that investment. And they are core partners within our integrated neighbourhood health teams and ways of working as well.
So they haven't so you haven't identified people to come to actually come onto the partnership?
Yes, so what we recognise is that there's hundreds of them in there, really, if you talk about it, because we've got the very small ones right up to some bigger organised. I mean, Locala, for all intents and purposes, they're a community partnership. Through the third sector leaders, they nominate who will be the lead into the partnership, into the PPP, but we use them then as the mechanism to make sure how the information gets out and comes back in. So it's not just the person who is sat there representing themselves and their organisation. There is a requirement about how they engage and get that information out and back, so we get those views.
You've just answered what would have been my next question, because obviously with voluntary organisation they may have specific things that they actually do, and we'll champion that, but it's good that there will be, with the third sector leaders, an oversight of all the different community groups that we actually have within, and voluntary groups within Kirklees there. Has anybody else got any specific question on this piece? One thing that came to light more at the West Yorkshire Joss was the involvement of commercial organisations within the place partnership thing. Obviously, we realise things will evolve over time and over years. But how would any agreement for a commercial organisation becoming a member be reached?
There's not really any plans to. So it's quite a difficult one to answer because so this is primarily about NHS partners, VCSE, local authorities working together to integrate services. There's not currently plans to bring in sort of, you know, the private sector NHS providers into these arrangements. I guess if there was the intention to do that, and there'd have to be a really clear reason for it, it would probably require a change to the MOU from the partners, but that isn't the plan or the thinking. Clearly, as an ICB, we have relationships with private sector providers, and we have something called right to choose, which means that members of the public can choose to receive care from private sector providers, and we have arrangements with those, but there's no plans for those to become part of the PPPs.
I think the only bit that I'd counter on that is where we already have an infrastructure in place for Kirker. So our care home market is obviously a very big market within Kirklees. Some of those are private, some are not. But they come under the auspices of the Kirker infrastructure, so we link and share information, work with them through that mechanism. And James Cregan is our representative currently as part of Kirker. So we recognise it from that perspective, but I think from what Ian was saying is where it's about health provision, and I think if you talk about Spire or somebody like that, we wouldn't be bringing them on as partners. They'd have a contract through Wyatt.
Thank you for that clarification. Is another question that we actually raised is for you to clarify which BCF elements, if any, are to be delegated to the place partnerships, and if so, what is the financial risk to Kirklees?
So I'll have to come back to you on the exact financial amounts because I can't remember them off the top of my head. So I think it's about 30 some million in total that's in our BCF. Within the BCF, what we've said that will be held by the Place Provider Partnership is obviously the health element that's delivering community services. Within the BCF, if you've looked at the Section 75 agreement, it's got a schedule of services and outcomes within that. So there are elements that are core social care services, and they're not up for grabs. They're in there as part of the budget that's delegated back down and out to place, but it will carry on delivering those core services because that's the minimum investment that was required. The BCF itself is up for review on a national level over this next 12 months, so they might change how that's governed, but certainly for the next 12 months the Section 75 agreement that we have in place has been just updated, reinforced, uplifts applied. We've agreed the schemes as they are, so there's no planned changes over this period.
Thank you for that. It was more specifics about, is obviously you can have a place partnership that is accountable. It's looking at, I wanted clarifications just to make sure that there was no financial risk to Kirklees.
No, because the way the contract to the Section 75 is constructed is well, it's certainly got another 12 months to run on it. It's very specific where the money is going, so the money that is allocated to core social care services is clearly defined within that, so there's no risk to that element of spend.
Again, moving on, obviously is regarding contingency plans for if any of the actual partnerships on the place partnership boards were to actually go, were to obviously withdraw from the partnership or become insolvent. What is in place for that? What my concern is that we need to be providing health, social care things for all of the for all of Kirklees what happens if, say, one partner withdraws, another becomes insolvent? What repercussions, what is in place there to ensure a continuity of services?
So the services and the lines that have been identified for the place provider partnership are all underpinned by either a contract section 75 agreement or a 256 if it's direct with the local authority. So we've already got contractual arrangements in place. So if any of our current providers either decide that they want to serve notice on a contract or no longer going to deliver it, we will follow the contractual arrangements that are in place and either put emergency measures or re-procure within the terms of those contracts. So those elements are still there through the shadow year, even though an umbrella of the PPP is being formed.
So what happens once you've come out of the shadow period? What contingency plans would there be in place for the partnership board once they are a formal body and not just a shadow partnership?
And I'm going to ask Ian to come in on part of this. The partnership board will be overseeing the totality of those contracts. The contracts that we have with a range of providers to deliver services on behalf of Kirklees will be managed. So it'll be doing the contract management perspective, as those contracts need evaluating, if we want to re-procure something. That's where they'll be making the recommendations and proposals. But the emphasis will be to deliver the services that we need for our population, and they'll run within the contracts underneath that umbrella organisation. Instead of the ICB holding all the contracts and renewing them all, reviewing them all, evaluating them all, deciding what we're procuring, it'll be done in partnership with that partnership. So within the Memorandum of Understanding there'll also be a set of conflicts of interest and things recorded to make sure that we're still delivering on behalf of the population.
Yeah, I mean, it's an
Sorry,
of course, yeah.
Can I just interrupt there? What support will the place partnership boards have from the ICB, from people that have procured contracts, who've got that experience actually be given?
So they will have that support. I mean, so the big sort of partners within this in terms of financial value, there's a good degree of stability around those, statutory NHS providers. As an ICB, as a commissioner, we deal with situations where a GP practice might withdraw from service, or a dentist, and work happens there to ensure there's an adequate provision for the population. As the commissioner, if that happened within a PPP, the ICB, as the strategic commissioner, which will remain as a strategic commissioner, would want to work with the PPP to understand the options available and ensure adequate provision of resources, services.
Thank you. Have the panel got any specific questions they wanted to ask on this? One thing that came quite clear at the West Yorkshire Josh, that is getting to where we are now seem to differ between different place partnerships. When we actually look at the work that was done in Leeds, and then we looked at sort of what had been done in Kirklees, why wasn't, say, the Leeds model used for Kirklees?
So why wasn't a Leeds model used for Kirklees? I think we all started in different places, and one of the things that we are working through currently is trying to get a degree of consistency. So we've spent this morning looking to see where we'll have a degree of consistency at what is done at place and what is done, if I say centrally. And the ambition of different places started in different places. Leeds did bring in an external company to try and help them, because their ambition, I think it's fair to say, they wanted to go straight to a IOH, originally in their thinking. So they've probably come back a little bit and we've progressed forward a little bit. But I think it's that process and that progress that we'll all be taking to get some consistency moving forward.
Yeah, I think it's a fine line, this one, because I think, you know, as colleagues have mentioned earlier, Kirklees is a unique place, and I think every place would say they've got their own unique partnerships, relationships, circumstances, and the last thing we want to do is impose a top-down sort of cookie-cutter approach on 5 places, because I don't think that would give the right answer. I don't think that would be seen as kind of working in true partnership. I do think there is value in sharing what works, and particularly if we're bringing in external support, making sure that's available right across West Yorkshire with these place provider partnerships, and we'll continue to ensure that we're working in that way.
Thank you. What?
I was going to just add, I don't know if it's helpful to understand, Councillor Lawson, that we did have a conversation about should we also commission Value Circle to do some of the work that we were doing, and we did actively consider that, but we felt quite strongly that we wanted to own what we were putting into the proposed place provider partnership, and we considered it and felt we had the capacity, we had the knowledge and expertise either at Kirklees or Calderdale or Wakefield. So that was part of our reflections of, you know, not commission an external provider to come up with those recommendations, but I don't want you to feel like it wasn't something we hadn't considered.
Thank you for that clarification. That is very helpful. Is one thing of it, obviously, is making sure that place partnerships are as open and transparent as possible, and that was why the actual question about whether or not the shadow place partnership meetings would be open to the public, and obviously moving forward. When they're more formalised, will they be open to the public? Would you then sort of also allow questions from the public to be put forward as well?
So I'll be honest, that hasn't been resolved at this point, but it is on the on the list of things that we need to resolve, to go through. At what point will we hold the meetings in public, or will the meetings be held in public? The one thing that I will say is across all the partners, it is recognised that the patient voice and the patient story is going to be crucial. So we're building that in from the beginning. So there will be a way for questions to be raised, very much how they are now. They can be submitted in writing and people can attend for the questions. But the citizen, the patient voice, the public voice is going to be central, and we're going to make sure through the agenda and the way that we configure those meetings that based on the agenda we will make sure there's patient stories and views brought in to help direct the work that's been undertaken.
So thank you for that. If I can move forward, we did actually raise the question of how fairness and equality would be assured across services, included in hospital care and out of hospital care. I think there was a slight misunderstanding. It was actually it wasn't that those providers would have an equal voice. It was how how the place partnerships board, how it would be envisioned that there would be equality and equity for the service users. How are you going to actually look at that moving forward?
So I think we haven't spoken much about the changes within the wider ICB in this conversation, but one of the things, the direction of travel for the West Yorkshire ICB is to become clearly a strategic commissioner. As a strategic commissioner, we will work to understand population needs, inequalities, which communities are being less well served by health and care providers, and commission and contract on that basis. So our contract will, with these place provider partnerships, will specify the outcomes improvements that we want to achieve, likely to be things like improvements in healthy life expectancy, the improvements that we want to see around reducing health inequalities, and that will form the basis of the contractual arrangement that we've got with the PPP. So if, in a nutshell, if the PPPs decide to focus on things to do with the acute trust and not those wider factors, then, as a last resort, the contract would not be paid in full in relation to that. And so the ICB is not, I guess, a passive participant in this. We are quite active in terms of setting the ambitions that we want the PPPs to work towards.
And would that be consistent over all 5 place partnership boards? Obviously, I know that things differ from differ from place to place, but would there be that overall consistency, and how would that actually be monitored?
I think the principles of consistency around improving outcomes and tackling inequalities would absolutely apply. I think the way that you might approach that in Kirklees and the population groups you need to work most closely with to address those inequalities compared to somewhere like Bradford or Leeds will differ. And I guess what we're trying to do is specify a set of improvements that are sufficiently broad to allow, you know, the real work to happen locally, as colleagues were describing, to focus on the populations where the greatest need. We know that the way that inequalities play out across West Yorkshire, there are some consistencies right across West Yorkshire, but there's also real pockets of difference, and we want to have local arrangements that respond to those effectively. So some consistency in terms of overall ambition, but flexibility to address it in a way that makes sense to local populations. And the data, as you're saying, that will be critical.
Thank you. Does anybody else have any questions on this particular subject? If we can then actually move on to one of the questions we put for, how will ICB staff be split across the three integrated teams, given that the Calderdale, Kirklees, Wakefield spans 2 acute trusts, 3 local authorities, compared to Leeds and Bradford that obviously don't, and also who actually decided that Calderdale and Wakefield and Kirklees would be amalgamated into the one? Will the size of our team, our team and support from the ICB be bigger, or will it be exactly the same as Leeds and Bradford?
So the integrated functions, there's on the structure chart, there's 3 integrated functions, one for Leeds, one for Bradford and one for CKW. So I think the start position on that is that the CKW one is slightly bigger in numbers of workforce and the available budget for us to have developed that team, recognising that there was, at a West Yorkshire level, that there was going to be more complexity because of the relationships across 3 local authority footprints. Within the design of the model, what we've attempted to do is make sure that where we can get efficiencies by having some of the workforce and the senior management as one single team, it is as one single team. And then what we've done is made sure that within the numbers underneath, people can have place facing to build up those relationships within each of the 3 places. But they will work as a single team against the priorities. Where it makes sense to deliver things once or develop things once, we'll be able to use that resource flexibility to do that, but recognising also where we need to do things maybe 3 times because it's working with the primary care teams, which are unique in each of the places. There will be people working with the primary care teams as well, but they'll come back together as that single team to share the learning, make sure we've got the consistency, all the things that we've said within that.
Yeah, I mean, what I'd add to that is that there was the reality of having to make the level of reductions that we've had to meant that it was impossible to retain 5 teams and establish the functions that we needed to at West Yorkshire level. So that was the compromise that had to be made. And as Vicky said, that there's a bit extra capacity in the CKW integrated team to reflect that. Really, really important, though, that we understand that it will be serving 3 places and serving 3 PPPs. What I would say, and this might sound a little bit like cold comfort, is that most of the ICBs in the country have removed all place-facing teams. And we've retained, as I said, just over 20%, I think it is, of our total capacity facing the places, because we believe that that is the best way to deliver our ambitions around integrated neighbourhood healthcare. So it's a big reduction, but we've made choices to, make some of the central functions quite tight in order to create this capacity to support places.
Just on your first point, because I just remembered it, about where the decision was taken about moving to CKW, that was done in advance of these changes being announced anyway. So that was a piece of work that had been undertaken, I'm going to say about 18 months ago, maybe a bit longer. So there'd been a whole scale. There'd been a review of how it was working, and it had already gone out to partners about moving to where it made sense to consolidate on a CKW footprint. That had already been discussed. So this has been an evolution of that work. It had already been decided before these changes were announced.
Thank you for that clarification. is you've obviously, when we asked the question around dental surgery, which is we have had the subject raised on a number of times here in the scrutiny panel. You actually said it would not be commissioned at a local basis, but I also know that there has been a lot of work done on a Kirklees sort of basis over dental, trying to actually get more appointments, and especially the follow-up, that, you know, the routine examinations for children and that. How is, obviously, with the staffing cutbacks, etc., how is that work going to be affected? Will there still be the striving for more improvement in the NHS dental provision within Kirklees?
Absolutely, yes. So the ICB took on the commissioning of dental services in April 2023, I believe, from NHS England, and you know, we have made improvements. Things aren't great, things aren't as good as we want them to be, but we have made improvements to services, access to services for children, you know, urgent appointments for the whole population in Kirklees and across West Yorkshire. And we've got data to back that up. The team that commissions dental services is a Yorkshire and Humber team. It's quite a small team. It's got quite specialist expertise, and so it works at that Yorkshire and Humber footprint. And that team will remain working at Yorkshire and Humber level, supporting all of the places across Yorkshire and Humber. There has been a very slight reduction to that team as a result of these changes. We've protected capacity in there as much as we can, because we know how important it is to people in West Yorkshire and in Kirklees, and we want to build on the improvements that we've made in the last couple of years. I think in the fullness of time there might be a conversation about whether the place provider partnerships could be responsible for dental services. I think we're a good couple of years away from that, because we were looking to build on the gains that we've had so far and stabilise the service through the commissioning model that we've got.
Just to add to that, I think dental is a good example of where things have been centralised and done as a car, but where the data and the information has shown where the inequalities are and the needs are, that's where you can see that Kirklees has had a benefit of that. So they've been bringing Kirklees up across, because it was recognised we had real pockets of deprivation compared to some other places.
It's actually really pleasing to actually note that there won't be any sort of major change to the provision with dentistry. They came to talk to us at the back end of last year, and you could see the progress that had been actually made there, and it wasn't just all around sort of getting emergency appointments, especially for the children, because to me it shouldn't be about emergency, it should be stopping those emergencies, and you could see that real work had actually been done, and I'm really pleased that that there isn't major changes there. Is the final question that I put is, obviously there are two parallel beings going on. You've got the work that the ICB is already doing, then you've got the support for the shadow place partnerships. Has that actually been risk assessed?
Yes, so there's risk. I think there's risk assessments coming out of his ears, to be perfectly honest. So at West Yorkshire level, we've got a full risk assessment, risk log of the risks that the organisational change is going to have an impact. We're working with our place provider partnerships now about developing their risk logs and what will be included in those at a place level. So continually, from looking at current business continuity plans, staffing reductions, all of that is being constantly, continuously looked at and risk assessed as we move forward. And again, we're having discussions about where we put in, at a West Yorkshire level as well as a place level, business continuity, and we're taking decisions about that support the transition process as well. So there's quite a lot of work where we're sharing resource across CKW, and we've always worked that way flexibly, depending if there's been sickness, etc., to be able to do that. But also on a West Yorkshire level about the prioritisation of of the work that we're undertaking.
If I could just, I was just going to add, you know, because we're in the middle and we've just, we've just concluded our first part of our consultation process with our staff. Just like any public sector organisation, we have to have robust impact assessments around any of those proposals. So, but I know that you would expect that, and that's what you would do as well as a local authority. So just to reiterate, you know, there's impact assessments for the current structure proposals that we've been underway with our staff.
And we've established a transition committee of the board to oversee the changes within the ICB as well as the wider changes through the integrated teams.
Thank you. Does the panel have any further questions on any of the topics that have been discussed today? What we will now do is adjourn the meeting so that we can then discuss our recommendations from today's meeting. Yeah.
Thank you very much.
Thank you and welcome back. The committee have deliberated our response to today's meeting, and I will ask our governance officer to go through the recommendations that we've made.
So it's been resolved today that the panel thank officers of the ICB, first of all, for attending the meeting today, that the ICB will provide the work plan for the design group, and that they will provide the plan for the organisational change, that the Health and Adult Social Care Scrutiny Panel receive assurance from the Council's executive team and portfolio holders of continued partnership working on the proposals to introduce the place provider partnerships and associated integrated teams, that the Health and Adult Social Care Scrutiny Panel receive regular updates from the ICB, the Council's executive team and portfolio holders. These updates will take the form of either briefing notes, informal or formal meetings. That the Health and Adult Social Care Scrutiny Panel reserve the right to formally consider whether the proposed introduction of the place provider partnership and integrated teams, whether it constitutes a substantial variation in service. That the ICB incorporate learning into future engagement with scrutiny, ensuring key structural or operational changes and supporting documents are provided at the earliest opportunity. That the Health and Adult Social Care Panel concurs with the views of the West Yorkshire Joint Health Overview and Scrutiny Committee meeting held on the 25th of February 2026.
Thank you, and again I'd like to thank members of the ICB for not only coming today but also for staying for the recommendations. We have one final item of business, and that is the work programme. Obviously, is for our meeting in April, we have moved the item on the quality of domiciliary care within Kirklees, and that will now be discussed at that meeting there. The item on the CQC, they will be invited to come back early on in the next municipal year. And if there's no further questions or any other comments, I'll close the meeting and thank everybody for their attendance. Thank you.